So if we were thinking about the healthy at every size model and supporting people in kind of opening up their mindset about some of the challenges and some of the identified things we need to really be mindful of when it comes to utilizing weight as a measurement of health, what comes up for you and what can you share with me from your expertise?
Yeah. So, I mean, I think when I'm talking to my patients, like weight is certainly it is an objective measure that we have that can be trended over time that can give us some information about what might be going on with the patient. So it's not as if it's a completely useless number to have, but it's never the number that I focus on as an outcome. And I think it's so hard for patients who have been so focused on that for a long time to make the connection that like you can actually engage in healthier behaviors, you can lower your blood pressure, you can improve your blood sugar numbers, you can improve your cholesterol numbers, but your weight might stay the same or go up or go down a little bit, but not as much as you have been told it needs to. But all these other very objective, data evidence-based measures of health outcomes and metabolic health are improved, and the weight number is the same. And that's a really hard mental shift for people to make because that's not what we are told our entire lives. We're always told like if you're overweight or your weight is too much or your weight is too whatever, your shape is this way or that way, it's unhealthy no matter what. But it's like you can actually make a lot of behavioral changes that will impact these numbers and your weight may never change.
Mm-hmm.
And it's a constant conversation and it's a source of struggle for patients too. Like I even had a patient recently say like, I'm doing all these things that I know are healthy. I'm eating regular balanced meals. I'm moving regularly. I'm getting enough sleep. I'm not drinking alcohol. I'm not smoking, but I still constantly wonder if I'm healthy.
Mm-hmm.
Because they're constantly getting this messaging of like, you're not healthy, you're not. And I'm like, you're one of the healthiest people I see
Yeah.
doing all of these behaviors consistently and, working on your mental health and all of these things. And yet it's this constant societal push of like, you're not healthy, counteracting the very objective evidence in front of you that you are.